this stuff is, you've already had it, we've been over it, whether it was with the cranium or facial bones. Okay, so the first part of the notes is, has to do with the mandible. If I don't say anything, if I don't talk about the anatomy, it's not gonna be on the test. Okay? So this is a review for the test. So remember, the mandible is the largest and densest bone in the face. And it's the only movable. Okay, composition. The mental protuberance is known as the chin. Okay, then we'll go down to the ramus. So the ramus is the vertical portion of the, and there's two, one on each side. It's the vertical portion of the mandible, and on it there's two processes. The anterior process, which usually sits higher if it's in the right position, is the coronoid process, and the posterior process is the condylar process. The concave area between the two is called the mandibular notch. Okay, so if you look, I know this is kind of not a really good specimen, but anyway. So here's the coronoid process, the anterior one, and here's the condylar process. So the little dipped out portion is the mandibular notch. Don't get it confused with the mandibular fossa of the temporal bone. That's different, which we'll go over in a second. Okay, the condylar process. On the condylar process is the head of the condyle. And remember, it articulates with the mandibular fossa of the temporal bone to form the Tmj. Where's the Tmj located?
Half-inch anterior to the EAM.
Good. It is located a half-inch anterior to the EAM, and remember, it's the only diarthrodal joint of the skull. What is diarthrodal?
Movable.
Really movable. Good. Also remember, where the body of the mandible meets the ramus, it's called the gonium, or angle of the mandible. Okay, paranasal sinuses. They call them paranasal sinuses because they all kind of communicate with the nasal cavity in some fashion or another. So you need to know the number for each one. So the maxillary has usually 2, the frontal has 1 or 2, the ethmoid has 6 usually, and the sphenoid has 1 or 2. Okay, so we'll start with the maxillary sinuses. You have to know what the other name for them is, which is what? All right, antrum of Highmore. They're also the largest and most anterior of all the sinuses. They are located in the body of the maxilla, and the bottom of the sinus is known as the apex, or the floor of the sinus. Okay, frontal sinuses, know where they're located in the region of the glabella, between the inner and outer tables of the skull. Ethmoid sinuses, they're located in the lateral masses, also known as labyrinths of the ethmoid bones. Sphenoid sinus, it's located in the body of the sphenoid, which is directly below the sella turcica. And if you see fluid in them and it's a trauma patient, it's probably a basilar skull fracture that you're looking at. And you would do a cross-table lateral to demonstrate that in trauma. Remember that all sinuses need to be done with the patient erect, and you should never angle the beam. So the beam should always be perpendicular so you don't distort the air fluid levels. Why do you need to do them erect?
Air fluid levels, right?
Air fluid levels. Because if you lay down, you won't see air fluid levels. Okay, the only projection, if a portable sinus series was ordered, and obviously this is a patient that you can't set up, it's a portable series. The only one that would demonstrate air fluid levels would be the cross-table lateral. It's on a lot of registry stuff. All right, so let's get over the images for your last clinical notations test. All right, the mandible. I didn't put any mandible questions on the test.
I have a question.
Yes.
Under maxillary sinuses, the location, it says body of mandible.
I know, I can't believe I
But it's
did that.
maxilla, right?
Yeah,
Okay.
the
Double check.
yeah. Did you see that?
I did.
I thought I told everybody that I Googled.
I'm lazy. it though. I don't know why I didn't say anything though.
Oh, you didn't say
I
anything?
didn't.
Oh.
But I saw it and I was like, I should probably say something, but I don't know why I didn't.
Well, the first Tuesday, lab didn't say anything.
Yeah.
I just going on and they didn't say anything. The second Tuesday lab, someone said, well, you know, it says mandible in the notes. I went, or maxillary in the notes. I went, so I thought maybe you brought it up.
No, I wanted something else, but I was gonna do it, and I was like, I don't know why I didn't.
Yeah. Anyway. So yeah, that is a typo. Did you understand what she just said? Yeah. Yeah, it's a typo in the notes. Sorry. All right, so the mandible notations, there's not gonna be any mandible questions on the next little quiz, notations quiz. Usually people don't do mandible anymore because of that. So, what is this? People know what it's called? I'm sure, has everybody had one of those done at the dentist? Yeah. They call it a panorex, where it goes around. That's why usually we don't do any images from mandible anymore because of these that are done at the dentist office. But they're still on the registry, so don't totally ignore them. When you go to study for the registry, there might be some on there. The one that I really want you to remember, maybe make a star by it because I see it on a lot of registry review stuff, is the PA axial for the rami of the mandible. So it's like a Townes, except it's reversed. So for that one, just know that the center ray is directed 20 to 25 degrees cephalad. So it comes up this way. So it's elongating the rami. So the condylar process along with the rami are best demonstrated. That's just for registry purposes. It will not be on your test. The next page has to do with the body of the mandible, imaging, don't worry about it. Okay, and the next page is the axial lateral. It's kind of a lateral oblique. Don't worry about that either. It won't be on your test. Okay, so I wanted to show you this, and I wanted to show you this one has a big fracture right there. And then I wanted to show you the reverse Townes. So it shows the rami of the mandible really well, and then the condyle here. All right, so the next ones will be on your test. These are Tmj projections. Some places still do these. They did these ones here at the VA, and they magnified them for me and sent them to me. So you need to know the Tmj rules. The first one is always do a mandible series first, because you don't want to open and close the mouth. Or tomo, which is really a panorex. So the TMJs are open and closed mouth, so you don't want to do it unless you rule out a fracture. Okay, you always do both sides for comparison, and you always do the open and closed mouth. Okay, and open and closed mouth will demonstrate excursion. What does that mean?
The movement?
Good, just the movement of it. All right, so the first one, Tmj Ap axial, it's like a Townes. For that one, you need to know the baseline. Number 2, place the OML perpendicular to the IR. And you need to know the center ray. It's 35 degrees caught at. All of them enter around the TMJ, so don't worry where they enter. Just know the direction. So this one's OML and 35 degrees caudal. Okay, structures demonstrated, the condyles and the mandibular fossa of the temporal bone. Sort of like this right here. Okay, so it's like a Townes projection.
Wait, what was that last one?
The structures demonstrated, the thing in bold, condyles and mandibular fossa of the temporal bone. rami, and the condyle is here. This condyle you can't see real well, but this one you can see pretty good. Okay, all right, the next page, it's called a Schuler. It's really like a true lateral. So number 2, you place the patient in a semi-prone or upright true lateral position. Don't worry about the central ray. Number 4, you need to know the beam is angled for this one 25 or 30 degrees claudad. And again, like all of them, you open and close the mouth. Okay, I guess at the VA they didn't do the other one on the next page, so these are both a left and a right true lateral. So over here, this one obviously you can see with the open mouth. So here's the fossa here, and here's the condyle here. So you can see excursion. Here's just the other side. Okay. So this is open mouth and this is closed mouth, where you can see the condyle or the rami coming up here and the condyle. Fossa there. All right, the next one is called a law. It's an axial lateral blade. It's very similar to this one, the Schuler, except for this one, you start the patient in the upright lateral position, same as the Schuler. And then number 4, you rotate the mid-sagittal plane of the head approximately 15 degrees towards the IR. So instead of being a true lateral, if I'm doing the right side, instead of being a true lateral, we just rotate a teeny little bit towards that side. For this one, the central ray, you don't angle quite as much because you angle the patient a little bit. You angle the beam 15 degrees caudal. We used to call this one 15-15, the law projection. And again, open and close mouth. Okay, for sinuses, that's the next page. All I want you to know for sinuses is the position and what which sinuses they best demonstrate. Don't worry about knowing all these positions all over again. Okay, so for the lateral for sinuses, number 4, all sinuses are best demonstrated, but primarily it's the sphenoid sinus. And again, I put it in bold, I just talked about it. A cross-table lateral for sinuses is the only projection that would demonstrate airflow levels in a portable series. Okay, so here's a lateral projection. So we can see all the sinuses. We can see the frontal sinus here. We can see maxillary here. We can see ethmoidal, the little bubbles in the orbits. And then we can see the sphenoid sinuses right here in the body of the sphenoid. So you can see all of them in the lateral projection. Okay, the next one is the Caldwell for sinuses. All you have to know is it demonstrates the frontal and ethmoid. Okay, so here's a Caldwell here. You can see frontal, well, and we can see ethmoidal right in here, the medial aspect of the orbit. And the ethmoid sinuses are located in what part of the ethmoid?
The labyrinth.
Good. Labyrinths or lateral masses. Good. All right. We'll go to the waters first, and then we'll go over to the Smb. Okay, for the waters projection, it demonstrates the maxillary sinuses. And for the open mouth waters, it demonstrates the sphenoid sinuses through the open mouth along with the maxillary. I think a little star by that. They like to put that on registry, the open mouth waters. Okay, so here's a waters projection here, demonstrating the maxillary sinuses really well. This one, they've got something going on here. Can you see it?
Fluid in the left?
Mm-hmm.
Is it fluid?
Mm-hmm. Good. See this fluid in the left maxillary sinus? That's all fluid in there. And here's the open mouth waters here. You can see right here through the open mouth, those are the sphenoid sinuses. You can still see the maxillary sinuses, but it's mainly for sphenoid sinus through the open mouth. Okay, last one is the SMB, and that primarily demonstrates the sphenoid sinuses. So if you look here, this is the Smb projection, and we can see the sphenoid sinuses in here. Any questions? It's a short little test, both of them are not very long. So the rest of this class, I gotta get you guys caught up with clinicals and what I'm gonna do, or what I might have to do or whatever. I just gotta make a note on everything as far as you guys are concerned. Also, I don't know if you noticed, but next week I'm going to review for the science comp. The science comp, I posted it in both of the lab classes. I'm not gonna do that whole outline. If you looked at it and freaked out, I'm not doing the whole, I know. I separate it in 4 sections. What I do is, what I have always done is, in the summer, I test you on stuff that you learned in the fall. So that was the whole big to-do class with the dean and that stuff. So, and then in the fall, I test you on stuff you did in the spring. This is all science stuff. This isn't my stuff, it's science stuff. And then in the spring, I test you in fall, and then in the summer of your last year, I test you at what you did in the spring. So it's just kind of, and if you look at that outline, that's all ART stuff. That's what the ART says they could test you on. Those are what they call specifications. So everything on there might be on the registry. I just review it because people seem to have a hard time with the science stuff. Okay, so that being said, I'm scheduling you guys to take your science comp. And it's gonna be on a Tuesday or Thursday. So, June 30th and July 2nd, for the second lab, pick times for those. So I have July 7th, July 9th, July 14th, July 16th. How many yours?
I do 16.
16.
Okay, so I'm starting at 8. So Kristen, wanna do the 8 o'clock?
Yes.
What other times are there?
The next one would be 9.
That'd be next one.
They shouldn't take more than an hour.
Okay.
I help you. It's not, I mean, I'm not gonna give you a test. It's an oral thing.
Is there a review already?
Next week.
Okay.
So you're 9 o'clock, Stephen?
Can I go after?
Sure. All right, that takes up July 16th.
So that would be 10 o'clock for me?
Yes.
Okay. Can I do the 9?
Sure. Tuesday, July 7th, Thursday, July 9th, Tuesday, July 14th. What time, Ashley? 8, 9, or 10?
Let's do 9.
Jim?
Can I do the same day at 10?
Sure.
That's the 9th, you said?
Yep. You would be 8 then.
You put me wherever you want. Okay.
Would you rather come in early or late?
Doesn't matter, whatever you need to fill.
Tuesday or Thursday, it doesn't matter either.
No.
I'm gonna put you on, just so we get it done and you don't have to wait until I tell you.
Okay.
July 7th at 8.
Alright, thank you.
1, 2, 3, 4, 5. 1, 2, 3, 5. Okay. Comps. I know heard back from everybody. So let me just make sure. Terry's gonna, do the oral comps. If you have anything that you're lacking, she's gonna do the oral comps during the summer. I told her I'm leaving it up to her to schedule with you guys when she's gonna do them. But they'll be done here, so she'll schedule me here. So let's see. Emmett, you don't have any to do?
Not that I remember. I don't know.
You were at the VA. I thought John looked at everybody's folder. He said he was going to. I don't think he ever got back with me. So you don't remember doing a comp and not doing the oral?
Yeah, I don't remember that.
Okay.
Pretty much doing them as soon as I could.
Did you?
Yeah.
Shanna?